All right, guys, great question came in from Richard in the Facebook group. I'm going to go ahead and read it, and I will do my best to give you my honest opinion. So Richard was saying he had a question. Thanks for the knee videos. You're welcome. He's 52, former military, current firefighter. Thank you for your service. I can't tell you how much I enjoy having police, military, firefighters in the clinic. It's just such a refreshing group of individuals to work with. So he was also talking about wanting to take his 3rd degree black belt test the winter of 2022. Another awesome thing. I grew up in a dojo. I love martial arts. I spent most of my life training, so I can absolutely relate. So I've seen your videos on tight knee versus loose knee. The one about shouldn't have pain in the back with flexion or pain in the front with extension. He has both. Okay, so that gives me some really useful information. That to me suggests that there's some mechanical things that need to be addressed, not just soft tissue things, not just tendons and ligaments, not just scar tissue. Thanks in advance. You're feeling frustrated. I'm sorry for that. I realize that we all heal differently and have varied degrees of badness requiring surgery. But he wants to get a general idea for some information. So he had a left total knee replacement. Not sure what kind of hardware. That's fine. Leg wouldn't straighten or go past 120 pre-surgery. So that tells me a lot. I mean, you're dealing with some history here right off the bat. So the leg wouldn't go straight and couldn't bend past 120 pre-surgery. Had 15 to 20 degree lateral bow knock knees. Wow. 15 to 20 degrees is pretty significant. If you guys haven't seen my video on the Q angle, you can go ahead and check it out. So there's a valgus and a varus. So varus is bow-legged where the knee moves away from the midline. Valgus is where the knee moves toward the midline. But they had to remove some old hardware. So that's interesting. I wonder what previous surgeries you had. Do a lateral release and add an extra plate to get it to straighten. So that's some pretty heavy duty construction. I've been completely straight, 0 degrees extension, and at the 3-week mark I hit 114 degrees of flexion. Phenomenal, like insanely good. 3 weeks, that kind of history, 0 extension. I wouldn't even care if you said you had less than 90 degrees of flexion, but anything over 90 degrees of flexion is insanely good. Now at week 7, I can't seem to flex past 110. More pain now than before. Okay, so let's stop right here. I take pride in my ability to work with patients, treat patients who specialize in individuals who've had a total knee replacement surgery. I can tell you right now, on any given day, between measuring range of motion with a goniometer, which is what I assume they're doing, I will easily be off 5 degrees, probably more than that. I'm being generous with 5 degrees up or down, meaning a swing between 110 to 120 in a given session, absolutely within reason. Goniometry is horrendously inaccurate. I don't care how much practice, I don't care how good you are. It's easier on some individuals than others, but please do not put any stock in the measurements that you're getting, especially not with less than a 5 degree variation. I could sneeze and get a difference of 5 degrees. So don't let that bother you. The pain part we're going to talk about, but the range of motion, I would not put any faith or stock in that, even for myself. Weird new pains I didn't expect. Honestly, that's usually a good sign. Honestly, having more pain at 3 weeks, or no, you're at week 7. More pain at 7, and more anything after 6 weeks. Weird new pains. What that's telling me is that you're probably doing more. Your body is probably adapting. You're probably on your feet more active, at least more active than you were week 1. I mean, is that fair to say? And I know you can't answer me because there's a video, but at 6 weeks, 8 weeks, 10 weeks, to have new pains, new discomforts, and you know what pain is, you know what soreness is, you know the difference between certain things. But I would tell you, with the history in the knee prior to the replacement, I think this is normal. I really do. Everything you're telling me makes total sense so far. Pain across the kneecap, yep, I would absolutely imagine that, and at the patellar tendon. So to me, that's associated with you pushing the progress a little bit, you getting maybe a little too aggressive. The kneecap itself, the bone itself, and certainly the tendon around it is dealing with a little overuse. I will experience something like this if I haven't done certain exercises and then I go back to them after a while and I haven't had a knee replacement. So I think it's totally reasonable that you're experiencing that specific symptom with what you're telling me. Pain on left lateral region, kind of where the meniscus would have been. Again, if you had a 15 to 20 degree angle in the knee, and now my guess is the knee is either totally straight or close to straight, yeah, like you were bowed in, right? So you had a valgus knee, an exaggerated Q angle. Now they push that straight, so you're going to have a lot more stretch on the outside structures of the knee. And it's not just the collateral ligament and the joint capsule on the outside. There's also the head of that fibula, the bone that runs up along the outside of the lower leg, that's going to come into play. It's used to sitting really close to the femur, and now all of a sudden everything is being stretched open on the lateral aspect. I totally expect what you're saying here. Major pain behind the knee, left side kind of where the hamstring tendon attaches, and behind the knee, super sore hamstrings. So my guess is, well, let me keep reading. The pain on the back of the knee seems to be what's stopping me from flexing now, almost like something is stuck. Yeah. So the description you're giving me here, and I do tend to see this in younger, more active individuals, is potentially some of the connective tissue, soft tissue, and the posterior aspect of the knee is getting pinched with any flexion greater than 90 degrees. You know, so we know that you have more than 90 degrees, and the way the knee bends and the architecture of the knee is one in which the way those two hamstring attachments come in behind the knee, there's multiple structures back there. I think what's happening is as you're going to flex, those structures are getting pinched. There are some things you can do to try and open up or stop the pinching. I can't demonstrate the videos right, or the exercises right now, but to explain, imagine you're on your hands and knees. Imagine you're in a quadruped position. So your toes are touching, potentially your knees would be touching the ground, and your hands are touching the ground. Imagine yourself going from that position up into kind of like a V plank position. So now just your hands and your feet are on the ground, your knees aren't touching. What's happening here is as you're doing a knee extension, as you're pushing your feet down, which raises your hips, you're creating a little bit of anterior glide in the tibia, which might reduce some of the pinching in the structures behind the knee. Another way to think about this is if you're standing in front of your couch or in front of a workout bench, your hands are on the bench, your feet are on the floor, and as you go down into a kneeling position, the act of going down, the eccentric motion, it's causing the quadricep muscle to pull the tibia anteriorly, which is creating a little space in the back of the knee. My hunch is you would feel less pinching in the back of the knee going into flexion that way than you would actively pulling yourself into flexion, like if you were laying on your back and trying to bend your knee so that your heel comes toward your backside. It's hard to explain, it's hard to visualize, but we do exercises in the clinic that try to activate the quads while the knee is going into flexion to see if it takes away some of the pinching behind the knee. But your symptoms are not uncommon, they're not unusual, they're nothing out of the ordinary. Absolutely talk to your surgeon about it. This is not medical advice, this is purely educational information. This is what I would tell another physical therapist if they came to me with a patient who had the same challenges that you're describing. Anyone have experience with these types of pains? So I see men with these pains more than I see women for whatever reason, but I do have women on the channel that are dealing with this exact issue. here. So I'm consistent with the exercises. I try to push myself past the pain, but PT was saying I'm only going to discomfort, not pain. Now she's super aggressive, warms the knee up with a hot wrap, that's fine. Manipulates the kneecap a little bit, that's fine. Then says, here we go, and bends me to pain and then beyond. That's where I lose a little bit of my confidence. There's just no benefit in these situations pushing through the pain. Only you know what you feel. I can never, ever, ever imagine to begin to pretend that I know what you feel. You're the one who knows if you feel a mechanical pinching in the back of the knee versus a connective tissue stretch in the front of the knee. If you said, I feel the connective tissue stretch in the front of the knee when I'm being stretched into flexion and you want to push through it, okay, that's your prerogative. But if you feel pinching and sharp pain in the back of the knee while you're being pushed into flexion, you're done. You can't do that. There is absolutely no benefit that's going to come from that kind of activity. It's not a grin and bear it kind of thing. I'm not against grin and bear it. I know there's a time and a place and a purpose for kind of working through, but it has to be with the right intention and the right, situation, and this just doesn't sound like it to me. I have a high tolerance for pain. I'm sure you do. You wouldn't have done the things that you've done if you didn't have a high tolerance to pain. Pain tolerance is not a good thing or a bad thing. It's just a thing. What we want to do is we want to make sure, what is this pain telling me? It's not a matter of experiencing the pain and pushing through the pain. It's what this pain is a symptom. It's a message. It's communicating something to me. If my body temperature is elevated, I have a fever, that's telling me something, that my immune system is fighting a bacteria or virus. The pain is the same thing. It's telling you something. It's not always right, but it does have to be listened to. So, if you're getting to the point of nausea, I would say as soon as you get to the point of genuine pain, you're not gaining any benefit from what you're trying to do. Is this normal? Not in my clinic, but I would never pretend to say the other therapist is right or wrong. I'm not there. I haven't evaluated you. I have no idea what's going on. I guarantee they're probably doing what they believe is in your best interest. They want to help you. I've never met a therapist that was outright malicious and wanting to cause injury. But, it's a team approach. You're part of the team. You have just as much say in what's going on as anybody else. If you felt these pains or had these pains, what are they? What did you do? So I hope I gave you some useful information. Like I said, if I can do anything, it's at least to tell you, yes, I see patients in the clinic who are dealing with this kind of situation. No, I don't believe it's the kind of thing you need to grin and bear and push through. Certainly not if you're experiencing what you're describing here. And I do think there are alternatives, but you're 7 weeks. You're 7 weeks. People are still walking on, using a walker and not driving at 7 weeks. You appear to be doing phenomenally well. Give yourself a break. Take a couple days off if you're allowed. Follow your doctor's advice. Follow your physical therapist's advice. But most often, in my clinic with my patients, when I see something like this manifesting, I do my best to try to encourage the patient to take 48 hours of rest. Relax, take it easy, drink a lot of water, eat some good food, sit out in the sun if you're somewhere where, spring is in the air. Because the reality is, if you're not seeing the gains you want to see, pushing at the intensity you're pushing, you're probably pushing too much. And you're not going to lose much in a 48-hour rest period, but you have huge potential to make huge gains. Most people who take a break who have been working hard see bigger improvements when they take a break. People who aren't working hard enough don't see improvements when they take a break, because every day is a break. But most of my patients, at least, they're working too hard, they're doing too much, they're pushing it. I get them to take a break 24, 48 hours. They come back with more energy, more range of motion, more enthusiasm, and all of a sudden they hit new PRs. So listen to your surgeon, listen to your therapist, do the best you can. I hope you got some useful information, and I appreciate you taking the time to post your question.